people have found it harder and harder to find dentists in this country. And we're going to talk to Dr Richard Marques, who is here with us. He is, of course, a man who is known for being, I'm not going to say celebrity dentist, Richard, but I mean, you are kind of a bit well known, so I'm very glad you've joined us. Thank you very much indeed. I've been sort of rather laughingly saying, well, people say you can't find a dentist, well, we found one. You seem to be sitting in a rather dark room, though. Is there any way you can lighten yourself up a bit?
Let me try.
It would be nicer to see you, because you're a sort of silhouette at the moment.
Yeah.
Let's see if we can do that. Oh, he's got up now. Anyway, here's the story. The story is this, that once again we're being told by the NHS that there aren't enough dentists because it's down to the government. Is it really down to the government? Let's ask Dr Richard. Is it the government's fault that there aren't any dentists?
Well, what we think is that the funding has been cut a lot for dentists. So there's a lot from the BDA about this, that the funding has been cut in real terms, and that another problem is to do with Brexit as well, because it's harder to recruit both dentists and dental nurses, and there's not enough qualified in the UK to really cover the full dental need within all the practices and the hospitals as well. So, you know, those are the problems. Like everything within the NHS is struggling from kind of budget cuts.
I mean, dentists that I've spoken to in the past have said basically that you only get paid a certain amount of money per patient, and it's not really enough to operate properly as a dental practice, and so you have to limit the number of NHS patients and take on more private ones. Is that about the size of it?
Yeah, so there's a limit to what you can do. There's something called units of dental activity, and once those are used up, that's it. You can't do any more NHS dentistry at all,
right? Even
if you're a mixed practice. So there's a very limited amount on the budget.
But isn't there some kind of dental kind of body or some NHS body? Because I always say to people in the NHS is run by the NHS, and I know the government is overall responsible for the budget, but the government is giving plenty of money to the NHS, so shouldn't there be somebody inside of the dentist's sort of practices who says, well, this is how you fix it? I can't believe this has been going on for so long and nobody's found a solution.
Yeah, so there's the chief dental officer, that's the head of kind of NHS dentistry in UK,
right? And
then any budget that we do have is kind of distributed to the lead dentist, or the practice manager would be responsible for sorting out within each clinic. But you know, obviously, as much as can be done, once the budget's gone, it's gone.
Yeah, well, I find that hard to believe, though, because I just find, I mean, as with most things in the NHS, and I'm not doubting your story there or your explanation, but, you know, if I'm working in an organisation and the organisation isn't working properly, you know, in any situation that was private, and if you do private work, you'll do the same. If your private practice isn't working properly, you fix it, don't you? You don't just let it carry on falling into rack and ruin and just hold your hands up and go, well, there's nothing I can do. Yeah.
Well, I agree, you know, there's a lot of waste within the systems, especially within hospital systems, you know, and they could work out ways to use the dentistry budget more effectively there. The other thing is they definitely need to do something, just like you said. They need to find a way to cut waiting lists and help out the patients who have been left without any dentistry. And you hear these stories about DIY dentistry. And
well, I actually know somebody that pulled his own tooth out, believe it or not.
Oh my gosh, it's awful.
I mean, unbelievable. But not because he was sort of at the end of his tether, but he simply couldn't get an appointment. He couldn't find a dentist to do anything for him. And a story in the Mirror today saying there's now 11 million people waiting to see an NHS dentist. I mean, that's ridiculous.
Yeah, it's really important.
It's like a fifth of the population.
It's crazy. And it's really important that they increase capacity, especially for emergency dentistry. You know, that's something that they've got to get people out of pain. Like, people should definitely not be pulling out their own teeth at home.
Yeah, they really mustn't. But then if you've got an incredible pain, and I know, having suffered from toothache in my younger years, it's one of the most awful pains you can have. And if you can't do anything about it, you would literally do anything to get rid of it.
Exactly. And the other problem is people end up going to A&E for the medical doctors. And some hospitals have dental departments, but if they don't, the doctors can't really do anything.
Right.
They don't have dental tools, they don't have anything. All they can do is kind of give painkillers. So,
I mean, I always, at this point, you get to answer this question. I always ask anyone who comes on as a dentist, if you were able to have a simple sort of solution, I know there may not be one, or if you were able to say to the health secretary, this is what you need to do, what would it be?
So they definitely need to increase funding, and they need to kind of open more clinics within the NHS, and especially if they could open more emergency clinics and just help to get through the waiting list.
Yes, but I mean, if you're trying to get a dentist and there aren't any, what are you supposed to do?
There is your local NHS bodies which can point you towards the practices that are taking on patients. So the sad thing is sometimes people have to travel a bit, you know, to find the dentist that has the capacity. So that makes it difficult for people who might have to travel a long way, particularly if you're somewhere remote.
Well, that is the problem, I think. If you're not in a city and you are in a rural place and you're not allowed to drive your car anymore because there's a new leisure zone that you can't afford to get through, you know, you're stuck, really, aren't you? But there we are. Listen, Dr Richard Marques, thanks very much indeed. We'll talk to you again soon, I'm sure.